we will discuss providers. So who are providers? In our definition, they comprise of the sites of care where care is delivered, as well as the healthcare professionals who work in those sites of care. So the sites of care can be divided broadly into inpatient and outpatient sites of care. Inpatient care is anything that requires an overnight stay at a facility. In contrast, outpatient care is any type of care for which the patient is discharged within the same day. Now, the healthcare professionals on the bottom here can be divided into two broad categories as well. The first is clinical providers, whose work relates directly to the observation or treatment of patients, and then non-clinical providers, whose work does not relate directly to the observation or treatment of patients. Now we'll talk about inpatient sites of care. Inpatient care occurs in hospitals, nearly 75% of which are nonprofit or public. Hospitals account for just over $1 trillion in total spending. Most community hospitals are in urban settings and belong to larger health systems. On the right, you'll see a more detailed breakdown of the different hospitals and hospital types, including, for example, federal government hospitals, non-federal psychiatric hospitals, and other types of hospitals, including long-term care facilities, prison hospitals, and college infirmaries. In addition to hospitals, there are 15,000 skilled nursing facilities that provide care after hospital discharge and before patients return home. Some addiction rehabilitation centers also provide inpatient care, although most clinics are outpatient. Now we'll talk about outpatient sites of care. So hospitals, about 50% of hospital surgeries are outpatient and the remaining 50% are inpatient. Ambulatory surgical centers are specialized facilities that conduct outpatient procedures and are often affiliated with hospitals and health systems. Outpatient sites of care also include individual and group physician practices, including both for primary and specialty care. One thing to note here is that physician practice ownership has been decreasing over the past 30 years. Below that, we talk about home health. Home health, and the largest component of home health, which is home nursing care, is expected to continue to grow over these next years to respond to the aging population. Below that is telehealth, which is a rapidly growing field of home health that allows certain types of healthcare providers to provide remote consultations via phone or computer. Telehealth is usually run by private for-profit companies. Growth and uptake of telehealth has been accelerated by the COVID-19 pandemic. Many hospitals, health systems, and insurers have partnered with telehealth providers to expand their services. We talk about hospice care. So hospice care is end-of-life care, primarily to manage pain and discomfort, and there is no attempt to cure the core illness with hospice care. In contrast, palliative care is a type of care that is for advanced conditions that also focuses on mitigating pain and discomfort. However, attempts to cure the illness continue. Other outpatient sites of care include imaging, radiology, and testing centers. And for these, there has been an increasing push to get these imaging centers out of hospitals to reduce the overall cost to the health system. We have pharmacies. There are about 190,000 pharmacists in the United States, of which 60% work in commercial pharmacies, 30% work in institutional settings like hospitals and prisons, and 10% work across government, academia, and the pharmaceutical industry. And then below that, we have urgent care facilities, which are basically facilities that have become alternatives to some patients who would otherwise go to hospital emergency rooms. Hospital emergency rooms are very expensive and chaotic sites of care, and both health systems and payers are pushing to prevent emergency room care by providing better options to patients. Urgent care clinics provide some primary care on an urgent basis, but do not handle serious emergencies. And in cases of serious emergencies, patients are encouraged to still see emergency rooms. Now we'll cover an overview of the service providers, both the clinical and the non-clinical. This is not a comprehensive list, and this is just here to give an idea of the types of roles that providers can play. We'll have more on this in a subsequent presentation. On the clinical side, we have physicians, nurses, and paramedical providers. On the right, we also have non-clinical providers, which include additional types of paramedical providers and administrators for hospitals and health systems. Here are some trends across providers in the United States. There has been a continued push to outpatient care to reduce the cost of care, the length of stay, the risk for infection, and increase capacity for more admissions. We also have seen a reorganization around value-based care, which is essentially when payments are tied to outcomes and not simply the number of procedures performed. Accountable care organizations are health systems that promote value-based care by coordinating care across doctors, hospitals, post-acute care, and other providers. We've also seen a consolidation of providers into larger health systems like ACOs and physician groups. We have seen on the right here an expansion of healthcare scope into broader public health activities. We have also seen expansion of roles and responsibilities for non-physician providers, primarily for advanced nurses and physician assistants. Something to note here is that COVID-19 has had a substantial impact on providers. There has been an acute shortage of nurses and hospital staff, both clinical and non-clinical, due to employee burnout. Telemedicine adoption has also been accelerated, and pharmacies are more inclined to ship medications and home COVID tests to patients. We have also seen a severe toll on skilled nursing facilities as they primarily care for elderly patients. We have also seen temporary or sometimes permanent closures of smaller or rural hospitals and provider practices, reducing the overall access to care for patients in some areas. There has also been a rapid adaptation to public health and infection control demands that have led to permanent changes in the way that many providers operate. Many of these are for the better, many of these are simply adaptations to the infection control demands.